Paramedics coming in there. I'm thinking, did this patient die? And no, she was drunk.
I go back to, I've done it for years, and I always tell people it's a time bomb just waiting to go off.
That one doc found, I forgot what it was, like 26 contact lenses or something in the eye. What's the most contacts?
I've seen 3.
How often are people passing out in the...
Apparently more often than what we think, yeah.
I had a guy who's, that macho guy, when you put their dilation drops in and you see them start like stomping their feet, and I'm like, you're not so tough now, are ya?
So we're here today with Dr. Williams, both at Fraser Eye. We see a lot of patients every single day. And I was thinking about all the different random interactions we have with patients, that with all the information patients have, like some of the questions they come up with. For example, I had a patient asking about cataract surgery, and they want to know, so we take the eye out, we do surgery, and then you put it back in.
Correct.
Have you ever had anybody talk to you about like removing their eye and doing surgery?
I feel like I've had people say that long ago they had some sort of eye injury, and for it to get fixed, they actually took my eyeball out, worked on it, and put it back in, and it's a miracle that they can still see.
You don't want to embarrass them and say, no, that's not how it happens. They take your eyeball out, you'd be blind. There's no repair to that.
Yeah.
Or another one I get, patients will sit there and freak out about any sort of eye surgery. It's natural. Nobody wants anyone touching their eye. And they're really freaked out. How are they going to keep their eye open during surgery? And they think the doc is going to be coming at them in front of them and doing work, and they just have to keep their eye open as he's going to make an incision to the eye. They don't understand that you're going to be laying down, have a speculum in their eyelid holding that.
Right.
And it's just... Everyone has so much information at their fingertips on their iPhones or Androids, and for them to ask those questions, it kind of blows my mind.
It does. I also think that people just get really stressed. So they start to think of these crazy scenarios or these irrational fears. I always tell them, like, your eye's numbed, you're relaxed, you're calm, and you're going to be through it before you even know it.
Absolutely.
And I always tell people, I know that when my time comes for, like I say, cataract surgery, even after I've been talking about this for years with people, I know I'll still have some, nerves and anxiety built up at that time, but I know that they're not taking my eyeball out, and I know that they're not just going to botch my eye or my vision.
Some people want to know everything, and then other people are like, you know what, don't tell me anything. Just do it.
I had someone a couple weeks ago who I was giving my generic, cataract surgery spiel. Here's what to expect. Here's what we do. Just want them to be informed so there's no surprises. And I literally just started by saying what a cataract was, and she threw her hands up and said, stop. And I thought I offended her or something. And she was like, I cannot know what this procedure is. I just need it done. Don't tell me the logistics. Don't tell me the specifics. Tell me where I need to be, how long I'm going to be there, and how long it's going to take me to recover.
I've had patients literally from a retinal tear say, you have a retinal tear, got to get you fixed. We're going to do a laser retinopexy. Literally, the patient passed out when the chair went down just from having the conversation that we're going to do a laser treatment to your retina.
I feel like anytime we talk about LASIK, even if they're the ones that are initiating the conversation, and then I just start getting into like basics, they start to get all squirmish. And again, I say, you're numb and comfortable. We're never going to go at your eye without any anesthetics. It achieves great outcomes, but then it's like we talk about a little bit of the actual procedure itself, and sometimes they're like, oh, never mind, you said laser. I'm like, well, how else? There's no other way to do this.
Again, yeah. All the information that's at everyone's fingertips, and they all can research everything. Mm-hmm. But again, depending on which type of surgery that they are going down, like LASIK surgery, elective.
Yeah,
they want to have that. They want to see better. When you get into like retina or even sometimes cataracts, it's like they're kind of in a way getting forced into it. You want to maintain your driver's license, you want to maintain your independence. We have to go this way,
right?
To keep all that. Here's the wild thing too: is we're all a society that we want it fixed like yesterday and everything's done. If you went back even like say 20 years ago, the whole numbing process was different. It was common even to do like a nerve block. So patients would get injections around their eye. It kind of like if you were at dental work done, your tongue goes numb, everything. You can do that around the eye. And that's still done for some things like from a retinal surgery standpoint, but standard cataract surgery. But patients would get black and blue, an injection around their eye. We don't do that anymore, right? For the standard cataract surgery, there is no nerve block.
Okay.
But even go back further, like say like in the 60s and 70s, when they had cataract surgery, they left them aphakic. So now those patients didn't have an implant, obviously. Yeah. So they would wear glasses that literally were like a Coke bottle look to them.
Sure.
people may remember grandma or grandpa back then, and they probably remember them having these thick eyeglasses. That's not done today. And the wild thing is the expectations have gone up so much that if the patient even measures like one step of prescription, without getting into too much of the patient, the implants only come in every other step of prescription. So if you end up with one step, that's still probably the best case scenario.
Sure.
But comparing it to the patients that had surgery done, 40, 50 years ago with their left aphakic, it's night and day. Kind of wish they can kind of see those experiences, and they would be so grateful for all the little simple things
for
that
what they're at now.
We're doing today.
Yeah, I think you hit it. I always have thought that like expectations is key for any sort of vision procedure, especially working in a practice that does so much of cataract surgery, refractive surgery. I do tend to tell people, even when they're wanting like a premium implant or a premium lens, because they really don't want to have to be in glasses or contacts anymore, I still tell them these are great options for you. However, there is still an opportunity where glasses will make things better for you at a certain given distance. And if that's just nighttime driving only, or it's reading for prolonged periods of time. I've had situations where I documented that, we talked about it because that was the biggest concern, and lo and behold, after surgery, how's your vision doing? Everything's great, but I feel like when I'm reading for periods of time, things get blurry, and I'm really not happy about this after the surgery. And I think it's just the expectations. It's really important for people to know that nothing is perfect, and there's always an opportunity to make something better, visually speaking, after a cataract surgery or a LASIK. The goal is to get you happy most of your day, comfortable most of your day, but if there's one specific thing you need correction for afterwards, I mean, from my perspective, I'd consider that very successful.
Yeah. So Amanda, from a patient standpoint, do you think you'd want to research everything beforehand? Would you want the doctor to tell you everything, or you're just kind of like, hey, just fix it?
I'm like very medically nervous. Any procedure, anything with the doctor, I get scared and anxious. So I don't want to know anything. I don't want to see pictures. I don't want to see a video. I want to know the outcomes and why this would be helpful to me. But in terms of how the procedure is done, I just want to know how I'm going to be comfortable and pain-free.
Pain-free is the biggest thing, right?
I agree.
So just want to get through the process, don't want to feel a thing. That's where the fine line is, right? You want to have everything done, but surgery is surgery. There's complications that are involved potentially, and you kind of have to go through everything. And you don't want Amanda be at the end saying, you never told me I was going to have dryness afterwards.
Yeah.
But some patients, like Amanda said, she's medically nervous. Some people just shut down, and they don't want to. I don't think they hear everything. They don't. Unless you play videos, talk with them. Maybe they see us, the surgical counselor, as well. And I think what people want to hear, they want to hear, and what they don't want to hear, they just tune out.
I think it's super beneficial when people will bring someone with them for any sort of consult for a procedure, because the other person is usually sitting back taking notes, because they know that the person that they're accompanying is that person who's, very stressed or anxious. And again, like you said, it's a fine line. Do I go through every single possible complication that could come up and then really scare them, and now they're not going to get the care they need? Or do we brush over some things that are mild, maybe could happen, but not something that's severe? And then, like you said, dryness after cataract surgery, they're fixated on it. Or they say, I've got new floaters, I've got more floaters now, and then I have to go down the whole route that's really not the case. You're just able to see more of them now. It is a fine line, like you said, between telling them too much versus not enough, and you don't want them to completely shut down.
How about when you're like talking to a patient, whether it's like before cataract surgery, or maybe they want to go into cataract surgery with a premium IOL, or maybe LASIK surgery, they're contact lens wearers. And then you have to get them out of their contact lenses. And then some people like give you some backlash where like, what are you talking about? I can't get out of my contact lenses. I have a high prescription, can't do it. But at the end of the day, you're trying to get the best measurements possible.
Sure.
The cornea has to be, pristine. Some people wear these gas perm contact lenses, but they've been wearing them for maybe 40 years, and now they're having cataract surgery. Well, a contact lens, especially a gas perm contact lens, can warp their cornea.
Sure. Throws
Throws all the measurements off. Get taken back sometimes where I feel like, I cannot take off my contact lenses for that amount of time.
Right.
But you're trying to make it as accurate as possible for them so they have the best surgical outcome.
And that'll be the person that, when all is said and done, when you're asking, how do you feel like things went, they'll say, I'm not happy with my quality of vision, and I don't see any difference, when that's a complete lie.
Right.
I feel like that is a very difficult thing to walk in. Some people, not that they're not responsible, but I think it's always important as a contact lens wearer to have glasses as a backup, even if they don't fit you properly, just something to get you by. And, when that maybe 2 to 4 week period where someone needs to be out of lenses, that wouldn't be an issue if you've got something as backup. It may not be comfortable. You may feel like you're not seeing as clearly, and that's probably true. I can understand that. But again, you want your surgeon to be able to do the best job they possibly can for arguably one of your most important senses. And if my doctor told me I need to be out of my contacts, I'd say, that stinks. I guess I'm going to figure it out.
Right.
But I do find it interesting too. And then I feel like they're always very aggressive about it.
One of your most important senses. Yeah, don't worry about it. I'll
Make
figure
it
out later on.
perfect,
Don't worry
but
about
I
it.
don't want to really kind of meet you with that halfway point to kind of help me.
Yeah. Contact lens wearers, I think, in general, that category of patients is a challenge.
It is.
No matter what you tell them, they're going to do something different for the most part.
Correct.
If they're wearing a one-day throwaway lens, they're going to wear it for a week, a month. You tell them not to sleep in it, they're going to sleep in it. Tell them to use this solution, they probably won't even use
They'll
that
use a different
solution.
one. I feel like I get asked all the time, why should I not sleep in my contacts? I've been doing it for 10 years. I'm fine. And they don't understand any risks of sleeping in lenses. They don't understand complications. And I guess it's hard for me to understand that because I'm working with this stuff all day, all the time, but it just seems like common sense and hygiene to me. You brush your teeth every day. You should take your contacts out every day. Again, they go back to, well, I've done it for years, and I always tell people it's a time bomb just waiting to go off when you're talking about corneal ulcers and infections. There was a patient in the clinic last week who's done this for years and doesn't take them out on a regular basis and had developed a fungal ulcer, and topical drops were not enough to control this. Now the patient's getting, injections into the eye to control the fungus,
Right.
And who knows what the visual outcome's going to be.
If it's fungal, it's probably getting injections weekly.
Sure.
It's not just a one-and-done treatment.
And these things can go beyond just, the front of the eye. They can spread, and they can cause all sorts of other issues too. And I think the most extreme would be an eye being taken out. I don't think that that's very common, but I've met several people who I had seen for a couple years. We talked about it, we documented. Important to take the lenses out, use a solution, use Clear Care for your cleaning if you're reusing the lenses. And I've had a few come back with central sight-threatening ulcers, and fortunately most of them recovered, with maybe a slight decrease in vision. But I've had a couple people that are probably at transplant status, but due to fear of surgery, they're just essentially working with one eye now.
Right.
How bad is it to actually rewear like daily contact lenses if you're taking them out, cleaning them?
Like a one-day throwaway?
One day. I've had some eye doctors say you could rewear that for a week as long as you take it out and clean it. I've heard that it's bad.
So in general, one of the biggest perks of wearing a one-day lens is you're not using a solution. You're always putting a fresh contact lens on, and you're always getting a clean lens on your eye. There'll be less protein on the contact lens. I will say that there are a couple contacts out there that I actually inquired with the company, and I'm like, the material, everything seemed exactly the same. The one day versus like their monthly lens.
Sure.
They were kind of like, they couldn't give me a good answer. I'm like, what is the difference? What is,
Mm-hmm.
Everything's the same, water content, everything's the same. The gal I talked with on the phone, she's like, I really don't know the difference. So I still haven't gotten to the bottom of that one.
Sure.
But the more you would throw away the contact lens, I think the healthier it's going to be. It just takes one bad infection, especially like a fungal infection, that's going to be a potentially game over nightmare. The cornea is going to get completely infected, opacified, potentially would need a corneal transplant, and that's a whole different game for just throwing away the contact lens. I don't see as many contact lens patients as what you have in the past. Well, what's your take on it?
As far as sleeping?
Just the one-day lenses, how she was
Like
saying.
if you clean them, let's say you wear your one-day lenses, take them out every night, but you wear them for a week.
I have always highly advised against it. And I guess, like what you said, there really isn't a clear answer, but I feel the people that are in the daily lenses were the ones with poor hygiene initially. That's why I switch a lot of people from monthly or biweekly into daily to help try to break those old habits, because they had bad effects with the other ones. So it may not even be necessarily that particular contact lens is bad for you to sleep in. The issue is, what is it doing to the eyeball itself? Okay, it's depriving it of oxygen. It's encouraging, microbial growth for those that live in an oxygen-free environment. So I don't think it's necessarily the contact itself. I think it's just more of its effect on the eye, but they are sometimes made of the same materials and same parameters.
patients will come in, then we have them take out their contact lens, and they get their case out of their purse or their pocket or whatever. And I swear it's probably the same case that they started with 10 years ago. They take the caps off, and you have like this brown ring around it. It's gross. At the end, I'm like, then they pop it in their eye like it's not. I'm like, there's no way you would have like he was mentioning like a toothbrush. There's no way you had like mildew in your toothbrush. You're like, yeah, no problem. I'm just gonna brush my teeth. People put it in their eyes.
I did literally I had someone. This was probably actually right after I graduated, so it was one of those first time things that I just kind of won't forget. But the contact lens case, a lot of them are like a white base with like a green or a white cap for the right and left sides, and the embedded R and L were like totally dark with just grime and dirt. And when they twisted their caps off, the inside bowl for both sides it looked like someone just dipped it in mud.
Yeah,
and you are just they're like, well, I new solution every day, and I don't think people realize that it's just festering in there. And I couldn't imagine. I took the case and the contacts and I threw them away, gave them 2 new cases, gave them a couple extra sets of trial lenses, and said, please wear these.
We're talking
the
pennies
basis.
for better health on that.
Sure.
But remember, did you see that little video that was out where that one doc found, I forgot what it was, like 26 contact lenses or something in the eye?
I can pull it up.
What's the most contacts?
I've seen 3 in one eye.
3 is my max too. I've had people come in for a consult blurry vision, and they have contact lenses stacked on each other,
Sure.
so they just can't see. They've tripled their power.
Correct.
Here's that video. Like I've never seen anything. Yeah, you can. So some people fear that their contact lens is going to float to the brain, so that's impossible. And there's like a little fornix up there that it can only go so high up there, so they all get trapped on top of each other. So the contact lens is not actually yellow. Amanda's making a really fun face here. She's really medical.
I don't understand how she didn't feel like there were just rocks up underneath that eyelid.
Oh my gosh, I cannot.
Yeah, so the contact lens itself is not yellow. She put fluorescein in there so they're all stained, but she just keeps on taking them out.
Yeah,
so it's not true that your contact can get lost in your eye?
You can't lose it.
I've had it where,
well, I don't know. If you look at this video, I'm going to say she lost a few.
But do you know what I'm saying? Like
it can roll and get folded,
it will come back, though.
It physically cannot get stuck behind the eye. It can get stuck under an eyelid.
Okay.
Like fold, but there's tissue that...
So eyelid, but you could just kind of lift that up.
Yeah.
Okay.
Yeah.
Enough of that.
It's amazing. And, a contact lens wearer myself, before I became in this career, or before I got involved in optometry and went to school, I had my fair share of nights where I would sleep in the contacts. But I would remember those nights were miserable. And when I'd wake up in the morning, my eyes were just on fire red, and I couldn't wear the contacts for the rest of the day. And my eyes just felt so brutally uncomfortable. And once I was kind of properly educated by my eye doctor at the time why I should stop, I was just like, oh, I will absolutely stop. And I never did it again. I mean, I might take an accidental nap for an hour with them in, but even after that, wearing a great daily disposable lens, my eye still feels like garbage.
But it is wild that, some people can go 6 months and their eye actually does look relatively good. I mean, the anatomy and how much oxygen the cornea requires for everyone probably is a little bit different. And then some people wear it one night, they come in the next day and their eye's just on fire, or they're developing an ulcer already. Why does one happen to another? But I don't know. In my opinion, like contact lens patients, they just have their own.
Sure.
They're a different breed, if you will.
Yeah. For sure.
But they do things. Did you see the video? So it was a WNBA. Caitlin Clark, I don't know, hit a gal, elbowed a gal, and her contact lens fell out on the court.
I did not see it.
Let me pull it up. Yeah, I think they were putting it in.
Her contact lens just popped out of her eye. I don't know if it was like her hand or her elbow hit her. So it cracks me up. So look how pale wood floor that is. And they found this contact lens in like 2 seconds. In the video we saw before, that girl had 28 contact lenses in her eye. We couldn't find any of those. But here... on the floor. But look so this is the WNBA. You would think that maybe there's a team doctor, or maybe she has an extra contact lens in her bag, or maybe contact lenses or a contact lens solution to rinse it off.
That's
But
that just makes me cringe.
With the solution, so if you drop a contact, and of course you get the debris off, but that's not like sanitizing the contact, is it?
It's not sanitizing, but there probably is debris in that contact lens.
I know,
I'm guessing.
but then
so
you still shouldn't put it back in, though. Even if you rinse it, it's probably just like get a new one.
I would say that. I'm sure
probably.
that she's got a spare
Yeah,
contact lens set.
you imagine, but there is the 5-second rule. I don't know if it applies to the contact lens industry or not. Oh, here's that slow motion, right? They just popped right in the
That's
eye.
a pretty hard pop to knock a lens out, too.
Yeah, look, and she found that contact lens. I was pretty impressed. But again, that's what I'm talking about. Contact lens wearers are just
Yeah,
they're
that's their own. They got their own rules.
They're going to do what they want to do and pop it in there. I wonder what it looked like, though. I wonder if she scratched up her eye. Because imagine if she put something on there and there is like just a speck of dirt on there.
Yeah.
It's going to be rubbing against her cornea, scratching it up. That's probably not going
Sure.
to help her game out.
Sure. No, it's not.
Maybe that's my problem.
It will be your problem. Say the win may not be worth the potential eye issues that come there. I would like to get her an extra set of contacts on behalf of myself.
Right? You want to donate? We can get her name. You can donate her
I would
a
love
set
to
of
do that.
contact
That
lenses.
would make me happy.
What team was that?
What's her name?
Dejanay Carrington.
Oh, there you
I'm
go.
gonna get you an extra set of contact lenses. I want you to see great for your game.
You mentioned like that one fungal infection that you had with, she's going to get injections to her eye.
Yeah.
The one thing I've learned over the years, people are not afraid to get a cut to their eye, but they're afraid to get an injection to their eye.
Oh, you
So
tell.
so they're okay with getting like a 2-millimeter incision to their eye, like doing cataract surgery. But if you're talking about like macular degeneration or
Yeah.
an injection to the eye for fungal infection,
Yeah.
you're like, what are you talking about? You're gonna put a needle in my eye?
Correct. I've seen people, again, shut down just the thought of that or hearing that. And whenever I have someone who needs to go see a retina doc, I will tell them, here's kind of what to expect. And I don't tell this to scare you, but I don't want you to be in the chair and all of a sudden Dr. Valise says, hey, we need to do some injections into the eye. I would rather you kind of be prepared for that. And you've got the weekend to kind of sit on it and process it. But I also explain, again, you're numbed up. I know that's still not a sensation you want to feel or even have to think about. But if you want to protect the vision from getting worse than what it is now, it's one of those things you kind of have to do it. And there's really no other way around it.
Right. And you get the anxious people like Amanda. Dr. Valise said I have to do an injection to your eye. Would you say, you know what, I'd rather go blind, or would you actually get the injection to the eye?
I don't want to go blind, but it would take me a couple weeks to accept that fact. And I would need to know exactly how he was going to numb it and how fast it would be. I need it to be very quick. Oh, I can't even imagine.
He has
I
it
hope
down to the
not.
science, though. I mean, he has looks at his wristwatch and he numbs the eye and he has to wait a certain amount of time.
How long does it take to do the injection?
So
Super fast?
the injection itself is really quick. It's all, we're talking matter of seconds, essentially.
Maybe I could do that. Maybe.
Well, hopefully you never do, but that
Sure.
patients have the same take as her. And they contemplate, like, I don't know if I want to have the injection, just ride it out and see what happens. And,
Yeah.
they develop a larger bleed and their central vision's gone.
Sure.
But just the fear of the injection. But that's the best thing that's come out with technology so far.
Right. Those people, again, 30, 40 years ago, if you were diagnosed with wet AMD, there was hopefully your other eye doesn't get ruined. And,
Not much.
And that was about it. And it's amazing how much the injections have worked. And there's several different kinds now. And when one maybe was not effective, we can just switch up medication and go with another one that's going to work better. But it definitely is interesting watching people talk about wanting to have these other procedures done, even non-eye issues and or non-eye procedures. And then the second you mentioned injection or shot, it's just you are not putting anything in my eye.
Yeah.
You're not coming near it with that needle.
Yeah, people are great getting like Botox all over their face and anything like that. It's just when you get close to the eye to
For
save
sure.
the vision,
To save the vision, yes.
to prevent the wrinkle,
Yeah.
all about it.
Mm-hmm.
Saving vision, yeah.
Do you feel like if you were not in your position as a doctor and you were a patient who didn't have like a medical background, would you be that person who wants to know everything about everything, or would you say, don't tell me and just...
Well, I'm a complete baby, I'll tell you that right now. I can't even get a cavity filled without... My dentist will tell you that right now. Like, I'm always a big baby when it comes to that. I'm like, I don't want to have any of that business done. And who wants this? Yeah, who likes pain? Nobody likes pain.
Sure.
And the thought of it, something happened to your eye, I probably would be the exact same way. And just we know the back end of it, and we know the good success and what the benefits of everything. I probably would want to just know kind of like the tip of the iceberg sort of thing, just kind of what do I need to know post-operatively, what drops do I need to do. I hope people coming into our building, they're like, it's a nice looking building. We know what we're doing. and just trust us and kind of go from there. But yeah, no, I'm not a surgery guy myself. I'll live with a cavity if I have to. I don't want to have that drilled out.
I know, as long as I know what to expect and I am told about what, potential outcomes could happen, I like to feel like I was informed. The last thing I would want to do is go through something and no one ever told me about it. Or even if it was a rare finding or a rare complication after, I would still like to know in the back of my mind, like, okay, this could potentially happen. So I think that I would like to probably know more than the average person would. But I guess as far as actual like surgical technique, I could probably go without. I don't know if there's a better way for us to start telling people with injections. Is there a more friendly word? Sometimes I find that just saying, "Oh, we just get some medication
we're gonna put
into
this
your
medicine
eye,"
in your eye,
and they, they'll say, "Oh, like it must be like a really strong eye drop," and then I kind of make that face.
That'd be
like,
worse if you were like, go see Dr. Valise, he's gonna
Yeah.
put some stuff in your eye, and then he walked in with a needle. I would say stop.
I
I'm
think you
leaving.
got the wrong room,
Yeah.
wrong procedure.
I'd rather know at least if I was getting the injection.
Yeah.
Yeah.
Not an eye drop.
Years ago when I used to do PDT, that was you'd get an IV injection of a medication and that would go up into the eye, and they would shine this laser in there, and that would seal all the vessels.
Mm-hmm.
Patients had to, literally cover up. They had, all the solar exposure.
Sure.
They had to watch out for that. It fixed the problem, but it created all this scarring. So ever since that, they realized that was not working. That's where all these injections came from. So injections have kind of been somewhat mainstream for a better part of 20 years.
I feel like patients who suffer with diabetes is probably the largest group of people that I see requiring injections and related to.
And that could be at a younger age, too.
Correct. I was just going to say, I feel like even in my short career so far, I feel like my patients with diabetes, generally speaking, they're, and later in adulthood, but I feel like I have seen a lot more patients creeping closer to, mid to late 30s, early 40s, and, I'm 30, and it's concerning to me to see that trend, and I wonder in 10 years, is diabetes in someone my age going to be like the routine? I always say that this job makes me really thankful for my health, and has kind of given me a new perspective and has encouraged me to do better for myself.
Right.
But back to the injections, we also know that they're very efficient and they work well, and I feel for the younger patients with diabetes who are dealing with this recurrent or chronic diabetic macular edema, and hey, how long am I going to have to get these injections for? And I don't have a perfect answer, and I usually will say, well, I can't give you an exact amount of time. I mean, you might be really receptive to one. It may take a few rounds to find the one that works best for you, but this isn't indefinite until you're able to get your sugars down, or co-management with their primary care doctor or endocrinologist until things can get stabilized. You're probably looking at these injections every 4 to 6 weeks, and it could be for a year, it could be for 5 years, and
there's no finish line.
There isn't.
And the root of the problem is the blood sugar, like you're saying. There's no doubt there's other issues going on. And, if you look back 50 years ago at society versus today, but, everything's Amazon, everything's delivered to our house. And
Sure.
You don't have to go to a store really at all anymore. You can go in Kroger, click list, and it's delivered right to your car.
Yeah.
So I don't know if we're not getting as much exercise, if it's all on our food, if there's something else. But I do feel bad for like the juvenile diabetics. So, nothing they did wrong. They're born and they're from day one. And it's not even like the juvenile diabetics, but imagine the mom or dad for that kid too. But I will tell you the one big game changer that this is a patient's mom was telling me this, that now like these continuous glucose monitors, like the Dexcom, she'd wish that came out years ago, because she never got more than 4 hours of sleep. So she would wake up every 4 hours, check her kid's blood sugar to make certain that she was doing okay. Well, now with the Dexcom, you can share it connects onto you, and it communicates with your phone, but you can share it with 6 different people. I think it's 6. I don't know if it may be more than that.
Sure.
And you can set alarms for it as well. So, like mom can, be in bed, go check on little Johnny's blood sugar. Blood sugar's good. You don't have to worry about, checking them.
Sure.
But like my daughter's good friend is a juvenile diabetic, and my daughter has her as one of her contacts. So my daughter's phone will have an alarm that goes off, and I'm like, well, how's Alyssa's blood sugar doing today? You could hear it going off. But how cool that is, and that didn't exist years ago. So hopefully, as you get more technology like that, people get better control, and you're going to have less injections along the way because people know exactly what's going on all day long.
Yeah. I would hope so. It seems like a very promising fix or method of curbing those eye-related issues. But yeah, like you said, the juvenile ones, it's sad. I
Right.
mean, I believe I had a 19-year-old with type 1 and appeared to be physically, healthy. And we go ahead and look inside the eyes, and vision was pretty normal and remarkable. And it was off to retina you go, just bleeding. You just know, from our standpoint, when you're seeing those changes in the eye, and organ,
Right.
failure or disease, and if that is how it's presenting just in your eyeball alone, I mean, just think of the rest of the body and every other organ. That's probably in even worse shape.
Right.
And it's amazing how sometimes people can look so healthy and not feel sick or have any issues, and then out of nowhere they collapse and one thing after another, and then you're looking at lots of medical care and potentially death. So
Yeah,
it's
like I said, the juvenile ones, I agree. It's just sad because they didn't do anything. There are some patients that come in, they have they're type 2 diabetic, and they have a Mountain Dew that they're drinking, and it's like, all right, well, you got to help yourself. You can't rely on.
Sure.
There's not an eye drop or the injection that's going to maintain your eyesight. And if you're having problems with your eye, you're having problems elsewhere. Your kidneys are going to be having issues as well. People don't realize how much it's affecting their eyes and their other organs.
Yeah.
Until something bad happens, until it catches up to them. Like you were saying with the contact lens, where until they do get an ulcer and they have a problem, then it's a wake-up call, and now you're backpedaling trying to get everything fixed.
Or a patient with poorly controlled diabetes who sleeps in their contacts and develops an ulcer. I guess that's a very specific population, but that's another person who is going to be really fighting for recovery, and their vision is in danger.
Amanda, do you sleep in your contacts?
No. I think I've fallen asleep in them one time, but truly they kind of bother me, so I always want to take them out at night. I'm ready to take my contacts out. But maybe a nap is an hour fine.
Yeah, I really for the most part.
We'll forgive you for an hour.
If you think about these contact lenses breathe so much more oxygen than what they did in years past. If you think, years and years ago, this is even before my time of, practicing, people were wearing those PMA lenses that were zero transmission of oxygen. So, there's a lot more problems with that and a lot more warping of their cornea.
Side note on contacts. Is it true that, so I wear glasses half the time, contacts half the time, but when I wear my contacts, I feel like I can see better, even though they're the same prescription? Is that just in my head, or is that a thing that contacts you see better if it's the same script?
I feel the same way. I think it's just...
Is there a reason, or why does that happen?
The optics are clear when you've got that lens directly on the eye versus the glasses that have, even though it's 11, 12 millimeters from your face, that change in light focus can degrade the image quality. And that's why people generally prefer to wear their contacts, especially with your higher prescriptions. Your -20, their glasses are super thick. Their quality of vision, even if they are able to be corrected to 20/20, they may not even achieve that in their glasses. They throw their contacts on, and there's no comparison.
Yeah, like I said, it sits off your face. So, and then depending on what's going on, how big the frame is, and maybe you got something with more face form tilt, you have more glare, the curvature is a little bit different, but also high prescriptions, highly nearsighted patients, you get a minimization effect as well. So you put that on the image, actually, you perceive it as being smaller. You put the contact lens on, and then you're okay. And it's even in between, say, for example, cataract surgery. Let's just say they're a high prescription, let's say a -9 prescription. Well, you do one eye. Patients want us to pop out their lens all the time. Well, you can't do that. Your brain's not going to tolerate a -9 spectacle lens one eye and nothing in the other eye. But if they had a it wouldn't be exactly a -9, but say -8, 8.25 contact lens, because they have to compensate for the distance, they would tolerate that just fine. So with all the other patients and talking about contact lenses, and there's always a fun patient group. There's always good stories with that.
Sure.
What's been one of your most interesting patient interaction stories that you've had throughout the years?
Do you have one?
Yeah.
Then I'll jog my memory.
There's been a few funny ones, but I was up in Port Huron. I remember what exam room I was in. Mm-hmm. So I had just started with the office. I probably wasn't even here a year. So this is going back quite a bit of time. But I remember going in there with my assistant, and it was an elderly lady that was in a wheelchair. Mm-hmm. And, she's completely hunched over. Just going in there doing a regular eye exam. Not thinking anything about it immediately. And people sometimes fall asleep when they're older and they fall asleep and she's kind of hunched over. So whatever her name was, and Mrs. Smith or whatever, she did not respond. And then
Sure.
I shake her shoulder a little bit, did not respond at all. So backstory, it was like her niece or nephew brought her into the office, who was in like the main waiting room. Mm-hmm. But the patient was in the room by herself. I'm freaking out a little bit. You're ready to just do a regular eye exam, and she's hunched over. And I'm 6'4", and she's in one of those little wheelchairs. I'm like, she's probably no more than like 3.5 feet off the ground. So I'm like kind of getting down, like trying to wake her up. So at the time, we used to have little smelling salts that were taped onto the wall.
Okay.
She passed out for it. So I hurt and got that, and I just put that. She didn't budge. And then now I'm feeling her neck, trying to see if there's a pulse or anything like that. So I tell my scribe, I'm like, just the hospital right across the street. I'm like, call 911. Those guys are there typically immediately. So we're trying to assess her, getting her down. Mm-hmm. And I'm freaking out. My adrenaline's rushing. We're trying to get her out of this chair to figure out how to really assess her. And then she does one of these things. She opens up and looks at me, and she goes, "What?" I'm like, "What are you talking about?" And I'm like,
"What do you mean, what?"
Like, you've been kind of passed out for like 5 minutes. We're trying. I'm like, "Are you okay?" And then she burps in my face. And I'm like, "What's happening?" I'm like, "What is going on right now?" So EMS came in there, and I was, she's talking to him, and she's like, "Did you have anything to eat or drink?" And maybe the thing in her blood sugar dropped or anything like that.
Sure.
She's like, "Well, I had a few beers this morning." I'm like, "That's like 9 o'clock in the morning." So she was been drinking, and that's why the salts didn't work, because she was drunk.
So did she reschedule and come back?
Yeah, I don't know, but my heart rate was like pounding like crazy. So I'm like, I was a fairly new doc at the time, and you thinking you're just going in there for just a regular eye exam, and I got paramedics coming in there. I'm thinking, did this patient die? And she was drunk.
It's funny you say about sleeping. That makes me think, when I was in I believe it was my third year of school, when we had kind of really just started in the clinics, you would be partnered up with someone for that semester, and you would rotate each week, who would be the doctor, who would be the scribe. And on one of the first few weeks, when it was my turn to do the exam, be the doctor, I got the phoropter in front of the patient, and we started off strong, and we were working on the right eye, and we went to go switch to the left eye, and I turned around to my scribe to just read some findings out, and I asked the patient a question, and I didn't get a response, so I thought, well, maybe she's just thinking for a second and didn't have an answer yet. And I asked it again, and I still got no response, and I kind of peeked my head around the side, and she had kind of done that same thing with the head, chin down, forehead forward, and I was like, oh, she must be asleep. So I looked at my partner like, what do I do? So I quietly said the patient's name, and there was no response, and then I said it again, and there was no response, and then I said it pretty loud, which I thought it was pretty loud. You could hear me from the neighboring rooms, and there was still no response. And I looked at my partner, and I was like, did this patient just die on me, getting her vision checked? And then I finally kind of hit her hard on her shoulder, and she just kind of woke up and was like, yeah. And I said, are you okay? And she goes, oh yeah, I'm fine. We're good. Just keep on going.
It's like better too.
Yeah, I was mind blown, and I was like, you really scared me. Are you sure you're okay? And she's like, oh yeah, I'm fine. I'm good. Let's go. So that was, that got me all stressed out for the rest of that day.
Like, Amanda, who do you think's more tough, males or females?
Females for sure.
There's 100% females are more tough when it comes to, you're welcome, when it comes to the eye.
I agree.
How many foreign bodies have you removed and the guy passes out? You got this big burly guy. You hear this story, and it is 100% true. You'll get a big burly guy. He's been, working in the shop in the factory, and all right, we've got a metal foreign body. We're gonna take it out real quick. No problem. You just do what you got to do. Go there, and then he's like, something's happening. This guy's going down. I was like, oh, here we go. And then you got all the charts are stacking up. You got this guy going down. You want him to hurt himself going, his head or falling.
Yeah.
How often are people passing out in their
more often than what we think. Yeah. It's not very often, but the ones that happen definitely are memorable.
I also had one in school. I went to go do Goldman on a teenager. I think he was in his late teens, maybe early 20s. And I could see that I was really close to touching the eye, and I could perceive that he was kind of leaning away. So I just was like, oh, I'll have you push your forehead up further again. And before I could say that, he kind of slid back and ran out of the room freaking out, and he passed out, woke up, and he goes, yeah, I don't like things near my eyes. This
Yeah.
tends to happen. And I was just like, you couldn't have told me that.
Well, there's that.
Could have checked some other ways, maybe.
Yeah. We can't blame the male in general all the way, because there's a reflex, an oculocardial reflex there. So there is actually a reflex when you touch the eye, things. But by far, I've had way more guys pass out than.
I don't think I've ever had a female patient pass out.
No,
Never.
I remember taking a foreign body out. It was a girl who was probably 6 years old. And she was at school and just playing around, and it was another kid hit her with a pencil. And she had a piece of, it was probably graphite, not lead, but that was stuck in her eye that we had to get out. And she sat beautifully, didn't flinch or anything like that. And it's one thing, removing out of an adult, but a 6-year-old,
yeah,
how are they going to sit? Are they going to, freak out?
That's
one more thing
for us to be.
Yeah, I still see her to this day. I'm like, I probably took that out, I bet you 15 years ago. She still comes in and we'll reminisce about that day. But to answer your question, I agree with you. Females are, from an eye standpoint, definitely tougher.
Every time I tell someone about removing a foreign body or a female patient, I'll be like, they'll probably be in some discomfort, today, tomorrow, but we'll get you there. And they'll always say, I gave childbirth. Or I went through childbirth. There's no pain. Don't you worry about it. Do what you need to do.
Right. People will ask, I'm like, will this hurt? And I'm like, have you ever had kids? I'm like, yeah, 3. I'm like, it's a piece of cake. No problem. You're good.
I like when I've had a guy who's, that macho guy. No, nothing hurts me. I'm not afraid of anything. And not mean, but just not super pleasant to kind of be with. I try to make jokes, make people feel comfortable. And it's those guys that when you put their dilation drops in and you see them start stomping their feet and getting real red in the face and deep breathing.
Right.
And I'm like, you're not so tough now, are you?
There's the dilating drop. Dilating drop will get you every time.
Why do they burn?
Well, you want the quick answer or the long answer?
Okay, quick answer.
Well, that way we know it got into the eye.
Oh, my. For real?
I was always told that, these are pros from school. That way we know we got into the eye, and if they could actually make it without the burn, it'd probably be too expensive. We wouldn't use it. It's just the pH is different than what our eye is, and it definitely irritates. And there's some people, we can numb the eye beforehand, but the numbing medication even burns a little bit for a few seconds.
Yeah.
So then
it's
you got
not that bad.
Putting 2 of them in. Yeah, I will say since COVID, some of the medications, I think they change labs, and some of the medications do burn a little bit more than what they used to in the past.
Yeah.
I feel like patients report that much more burn than what there was years ago.
I feel like they've always burned.
COVID ruined everything. Even our dilating drops.
I thought of a question to ask you.
I'm ready.
What is a story or a finding that you have that led a patient to a larger diagnosis?
Probably in the last 6 months, she was a new patient just during the examination. So just kind of routine examination, just giving her glasses, talking about her dry eye. Mm-hmm. She had a melanoma in the back of her eye. So actually it involved even the iris as well. So it was in the back of the eye and the iris.
Sure.
So the cool thing is we had all those imaging tests. We did the eye. So we take a picture of the part of the eye. We took a picture of the back part of the eye. Got everything all, everything ready for the referral because we referred her to the retinal oncologist.
Yeah.
Lucky for her that it was just a primary cancer. It didn't metastasize anywhere in her body.
Yeah.
Unfortunately, she had to have her eye removed, and she was fit with a prosthetic eye.
Mm-hmm.
So a very sad scenario, but at least it was caught before it had a chance to spread, because if it spreads to the liver, your mortality rate is significant. So that's probably the biggest one off recent memory. What about you?
I had a 5-year-old that came in for failing the vision school screening. And when I was the tech was getting her all set up for me to go in afterwards, and I was kind of following along on the chart, and her autorefraction showed moderate plus. So I was thinking, it's probably just, she needs glasses and this will be fine. And I went into the room and just quickly introduced myself and said, hey, I want to get some other drops in the eyes so we can get a better reading and make sure we're checking out everything today. Blah, 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 probably a high glasses script. We're going to probably end up doing this, do that, and follow up. And I brought her behind the slit lamp just to get a quick look at the front of the eyes and just band keratopathy over both corneas from 3 to 9 o'clock. Very dense.
How old was she?
She was 5.
Yeah.
She was 5 years old. And I'm asking the mom, I'm trying not to scare her. This is her 5-year-old daughter who's otherwise never expressed any concerns or issues about her eyes. I'm just saying, joint pain. Has there been any complaints from her end about having a hard time seeing? And, no, everything's fine. Why are you asking me this? What's going on? And that was one of the hardest things I ever had to say was, your daughter's got juvenile rheumatoid arthritis, and we need to get to a specialist like yesterday, like forever ago. And my heart just broke for the mom, because she's like, we've never had any issues, never complained. She's never like expressed anything. I've never even seen her like rub at her eyes. And outside of saying you could have brought your child in a little bit sooner to get an eye exam, there's nothing. And, don't beat yourself up over it. I mean, it happens, and that's just the reality of it.
Could be some things that, with like some of the chelating agents that can help dissolve some of that too. That could have a chance. But it's just horrible at 5 years old. Yeah,
and I mean the chamber, was just filled with cells, and even trying to get a fundus view in some of the very small areas where there was no band keratopathy. I mean, it was just haze.
Yeah.
So I mean, it was.
So
she was having blind cells. She was having active inflammation in her eye too. Of all the different eye conditions out there, you just mentioned a 5-year-old. I have had it young. A mom brought her young child in, older than 5, but it was teenage years. It's been to multiple different doctors. Prescribed glasses really have no significance.
Sure.
Patients like minus a half, so really nothing high. But the patient kept on saying, I can't see. Gone through like 3 or 4 different doctors. Long story short, patient has retinitis pigmentosa. So retinitis pigmentosa, you lose all your peripheral vision. It's up there as, I think, in my opinion, number 1 horrible eye disease, just because there's nothing you can do. And it happens at young kids that they didn't do anything. It's just a genetic issue. But losing all this peripheral vision, she's left with like this little tunnel. She couldn't see out. Yeah. It was very aggressive for her.
And they'll never regain that back. It's just gone.
No, they won't gain it back. They've done studies on high dose of vitamin A, and that didn't do anything. There was a company with Spark Pharmaceuticals that was doing, if you're a candidate for it, because you do a cheek swab, you can send it out. And there's a few sites in Michigan that were allowed to do this injection, but it was trying to slow it down. It wasn't necessarily fixing anything. It's not every day you see a patient with retinitis pigmentosa, but there's not a lot you can do with that. And it's poor kids, and you lose your independence. These kids will likely, if they do have a driver's license, they won't keep a driver's license for very long because they lose so much peripheral vision. And now their occupations are going to be affected by it. It
changes everything.
We're really good at diagnosing eye diseases and everything else. But have you ever been out in like a public area and they said someone's having an issue and they say, "Hey, Brett's a doctor. Come on over here."
It's not happened to me yet. I usually won't volunteer what I do unless I'm like on a one-on-one conversation with people, because I don't want to be making that my focus when I'm not at work all the time.
Sometimes, like with my brothers, we'll be out and they just they try to be comical. But like someone will bring up I'm an eye doctor, and you remember from like The Hangover when that guy, he's a dentist. I'm like, he's an eye doctor, so if someone has a heart attack, you still call 911. Like,
you can't help them?
So like,
come on.
I'm like, this is true. That's good. And I'm like thanks for like pointing that out, guys.
Correct.
Appreciate it.
Yeah, I haven't had it happen too much.
Not on an airplane, and someone says
not on an airplane. I would never volunteer that information.
He's putting his hat on.
Yeah.
Sunglasses.
Yeah, sunglasses.
Zipping up his sweatshirt.
Big frame sunglasses, just hood up.
What if someone lost their contact lens like that basketball clip? Would you help them get their contact lens in their eye? Or would you just put the hood over?
You would tell them, don't put it in your eye.
Yeah, I'd probably say that. And then they'd say, why do you care? And then I would.
You're like...
I just, no particular reason.
Like, I'm an innocent bystander. I'm the contact lens police and just want to make certain.
The contact lens police. My wife gets that stuff all the time. Being a vet, friends, family, call random times of the day, Facebook messages. Hey, I haven't talked to you in 15 years, but my dog's throwing up. What do I do? And her response is always, honestly, take him to the vet. I physically can't do anything. I'll answer questions, but I can't give you advice without seeing them.
That's true. Like, people put their eyes on the back burner, but if Fido has a problem, they'll be calling anybody and everybody for it, right? Has she ever got a call from her friend saying, my pet turtle seems like it's sick?
I'm sure she has. What
would you do for a turtle?
Take it to a vet that does exotic animals.
They don't all do exotic animals. It's like a specialty.
Yeah.
Makes sense.
Does your wife do anything on like eye exam wise on a dog, cat?
She does routine eye stuff.
Just like a red reflex?
Kind of. She'll treat corneal ulcers and dry eye.
Can dogs get cataract surgery?
They
Because
can.
I know they get cataracts. You
They
can see
can.
them.
They can.
So
They can.
yes, and there is someone that locally, that does them. They do them both eyes same time. They just take average. Each dog has something on an average, right? Like the curvature of the cornea.
They just go for it.
They both eyes. We're just going to do this, and it's
Usually.
expensive.
Usually.
It is expensive.
Pet insurance.
Will that cover cataract
Really?
surgery?
I don't know. But it'll cover a lot of other stuff.
But I don't know. But it may be like out of pocket, like $10,000 or something
Sure.
to do
Wow.
cataract surgery.
Mm-hmm.
Would you get surgery in your cat for $10,000?
But cataracts they can still see, just not like great, or they can't see at all.
Okay, let's say your cat.
Are they fully blind?
Your cat is walking into walls.
Don't make me do
It goes to
this.
jump in its bed and it just misses
$10,000.
$10,000.
I can't say that I would. No.
How old are your cats?
3 years old.
But cats can live to be like 20,
But-
right?
Yeah, I don't know.
Maybe a payment plan.
A payment plan. You're putting me in a bad spot right now.
Well, you have two of them, right?
Yes, and I love them.
What if you just put a
If
leash?
they were
What
blind,
if you
they
just
would
put a
still be
leash?
happy though. They could still be very happy.
You just leash one to the other one. So that one's like it's
No.
it's guide dog, it's guide cat.
It's guide cat. It's guide cat.
Anything more than a couple thousand, they're staying blind.
Yeah. 10,000 is crazy actually. If it was 1,000, yes. Not 10.
I feel like people don't realize, and I was in this group too until I was exposed to the vet community, but healthcare for humans is super expensive. We have insurance that covers it to some extent, and that care it's still the same procedures, maybe to a lesser extent, but it's still expensive to provide medical care, surgical care to a pet. And if you don't have anything else helping you with your coverage, yeah, it's expensive. A blood draw or certain labs could be a couple $100s for your animal, and it's a couple $100 for us, but we don't see that because of our insurance. We pay maybe $20, or maybe you've got stuff covered. I think there's a big disparity between knowledge of what true costs are. And
Yeah. I
that-
paid like $700 for my cat to get labs the other day, and it was like minimal.
Yeah,
Are they
So-
okay?
They're okay.
they're okay.
Don't worry.
So I have a black lab. He's like 110 pounds, and he was probably about a year old. And I remember I was gonna go to a graduation party. My dog at a year old was very hyper and playing around. He'd throw a ball and he was running around, and he was outside with me, and he would just lay down. I'm like, pick the ball, throw it, and he was just looking at me. He would just kind of lay there. I'm like, this is not right. So went late to the grad party. I'm like, I got to take this guy to the vet. I'm like,
Yeah.
something is wrong with this guy. And then his stomach was really like bloated looking. And then I'm like, did he eat a sock and everything's backed up? I have no idea. So I take him to the emergency vet, and then they analyze him real quick to make sure it's, is this an emergency? Does the dog
Sure.
need surgery? And they came back there and they're like, he's okay right now. So he sat there. I sat there for like 5 hours at the emergency vet.
Mm-hmm.
Get back there, they do x-rays, and they bring me back. They go, hey, come over here, I want to show you something. And I'm like, what did he eat? He's like, yeah, I don't know what to tell you, but he got into his kibble. He ate a bunch of food, so his whole belly, he's like, his stomach should look like this, and he's like, his looks like this.
He just ate.
He ate and ate and ate and ate,
And
and
he
then
didn't
he
stop?
was huge. I'm like, what do we do? Do we like pump his stomach?
it out.
I'm like, what do you do for this guy? He's like, oh, you want to do that? Because he's like, then your dog can get, I don't know, you can have your wife flip stomach, upside down stomach, something stomach that
Can bloat.
something.
Yeah.
He's like, we don't want to do that. He's like, just let him pass it. And I'm like,
Seriously?
and I looked and I'm like, I'm there. So my bill was like $600
Sure.
For
because
that.
my dog overate.
Yeah.
So I was looking like,
He's a hungry
I'm
boy.
like, you son of a gun. So I missed the party, and I was sitting there with hours upon hours because my dog
Overate.
he would have ate himself to death. So yeah, I wouldn't spend $10,000 on cataract surgery at that moment for that dog. But in general, he's a
Any
good
other
guy.
moment you may have though?
Maybe he's a good guy, but I was kind of hoping he was something more eventful besides him just getting into his food. I'm like, I was hoping, I don't know.
But they might have to do surgery if it was like a sock or something crazy.
Yeah.
But he's like kind of like a hunting dog. I thought maybe he did
bird,
something. Maybe
a
got a
squirrel.
bird or something. I'm like, all right, good job, guy. You did your job. And no, he's somehow, some way, essentially was. That's how smart this dog is supposed to be. Like, he came from a very smart group, right? His brothers and sisters, cousins some of them were like police dogs. They worked. Not to say they're a police dog. They worked
But they
in
were, like, in
the
a-
police department or something.
Sure.
Other ones have been
Seeing eye dogs?
not seeing eye dogs. No, they but athletic dogs, they like dock jumpers and like all these hunting dogs. You can bring them back, and so I'm looking. I'm like, I don't understand what happened. I'm like the gene line is there. I'm like, I don't get it. I'm like, what happened?
He just likes to hang out.
Just likes to have fun.
How many cats do you have?
One. We're a 1-cat household.
What's that? Is
That's
that a thing? You have a
That's
vet. You should have like 29
Nope.
animals.
Nope. She would say no before I would.
She probably deals with him all day. She's
She
not trying
does.
to deal with all that.
That is exactly it.
Makes sense.
That is exactly it.
I only have 2 cats because they came together.
So that's double of what he has, and he's has.
Okay, but they were bonded, and you can't remove them when they're bonded,
cannot.
and they entertain each other. So honestly, to me, it's better to have 2.
You should get another one then.
Well, not
No.
if it's too
There's
far
enough litter on the
removed.
floor.
There's
I
what?
vacuum almost every day. They're just I can't deal with the litter.
So if your cat had cataracts, and then your wife is a vet, would she do surgery on him?
Probably not.
No.
No.
As long as they're happy,
Yeah.
they're okay. They don't need to see.
Listen,
always.
she's got 3 beds. She gets fed precisely twice a day on the hour. I mean, she gets to hang out with us when she wants and go away when she doesn't. She's fine. I think if her eyesight was poor, she would still be living a very lavish lifestyle.
Do you have do you have like one of these strollers that you take her off for a
I
walk?
do not.
Amanda, are you that person that has that?
No, my cats are scared of like loud noises, so they can't go outside.
Like go to a mall with a stroller.
Mm-hmm.
I would never do that.
Yeah, it's a whole different.
I do have little Sherpa sweaters for them though.
But there are people that dress up their dogs. They put sunglasses on dogs too.
Do dogs need sunglasses? Will it benefit them or no?
Well, I guess
I guess it
UV
will.
light, I'm sure it would benefit them to some degree, right? But how are you gonna
Yeah.
get a dog to wear sunglasses?
They have those like straps.
Little straps
Yeah,
like I
mine's
wore
that.
when I was 4.
That's not happening.
No, that would not.
Can you get a pair of sunglasses on your cat?
No. I
Without
also
getting
never
bit?
tried.
Now you're going
Well,
to.
they're inside. Do you need sunglasses indoors?
I mean, maybe if they're sitting in a window and they're looking outside all day.
Yeah.
But these are like, okay, if you do buy cat sunglasses, they're not going to actually have UV protection, I'm sure. They're just for style.
Speaking of sunglasses, do you wear them often?
I do, but typically they stay in my car because I have a problem. I always leave my sunglasses behind. So they stay in the car.
Is there a certain brand you like?
I like the Oakley ones myself. I have Oakley, I have Ray-Ban. I feel like just Oakley's more snug to my head. So if I am outside wearing, playing like
Mm-hmm.
golf or doing just something, I don't know, I feel like they're more snug.
Have you ever had a pair of Maui Jim sunglasses?
I have a long time ago, though. They were pretty good too.
I just got my first pair recently, and I swear that I see better. They're not prescription. I wear them over my contacts. I swear I see better with them on than I do without them.
Really?
They're very crisp.
Not even from like a light sensitivity standpoint. Just everything is so defined.
Let me ask you this, because I do have a newer pair of Oakleys, my most recent ones,
Mm-hmm.
and it has like this bluish lens, and it makes the grass look so brilliant green. Like everything just pops.
Yeah.
It is kind of bizarre how, you can, I don't know, skews the color channel a little bit and it just makes that pop so much more.
Sure.
Is that what you're saying? Like the colors are just like things
Everything
like pop?
is, yeah. It's just, I feel like I'm looking through like high definition. Like I see well.
That's Maui Jim.
Yeah.
Do you have Maui Jims?
I do.
You like those?
Mm-hmm. I would say out of all my sunglasses, the lenses on those are definitely the best.
And they've got it like as a gradient. So as you're looking, like if your head's tipped at different angles, the image like clarity and color can change a little bit. I forget the term that it's called, but it's as you physically are sitting there moving your head up and down, you can perceive a difference in shades.
You gotta be careful if you're just doing that.
Oh,
you,
yeah.
You could be at a beach bar or something like that, drinking your Coronas or something like that, and you're just nodding your head up and down.
Well, I
You get in
generally
trouble.
I generally take them off when
You're
I'm
like, what's this guy
indoors, so
nodding at?
Generally, those are off indoors. But I do have my sunglasses on pretty much every day of the year as soon as I get out of the house. I've always just been super sensitive to
Yeah.
brightness.
Yeah, you left him at work one day. He's like, "Are my sunglasses there? Where
I
are
did.
they?"
I did. I was in the car for like 15 minutes after I
Like,
was supposed to
no.
have left trying to look for them, and then I gave up, and then I messaged her and said, are they there? And she said, yes, I'll take good care of them. And they're my blue ones, and if you know me, blue anything is very important to me.
Right. Did you get them back?
I did.
Were
She
they
took-
scratched up?
They were
I
not.
took good care of them.
They were taken care of.
Did you look through them?
No, I have some. I didn't
Yeah.
test them out.
She's checking out, doing that gradient. It's like,
Yes.
The first pair I got, I was given a voucher at Vision Expo last year for a free pair. So
Free?
yeah, they were free.
Wow,
Yeah.
normally like
I know they are. So I was very
300,
fortunate to have come into that. But the other pair, my second pair I bought, which we don't have to talk about that. But, that was a treat to myself.
There you go.
But I just never understood the hype. Everyone would be like, for years, people would ask about sunglasses, and I was like, oh, Ray-Bans are good. Really anything polarized,
Right.
no particular brand. And people would be like, have you ever had Maui Jims? And I'm like, no, I sometimes will just go with like $10 ones off the rack at the grocery store, like just something. They're like, you need to get some Maui Jims. And I
Right.
never understood the hype, and now that I've got them.
Yeah, so he tested that like cheap sunglasses, $5 from the gas station versus Versace. They work just the same, essentially, in terms of protection.
The Versace weren't mine.
But you still
Thank you
tested
for the
them.
clarification. I was concerned.
Yeah, well, we tested even our glasses that we give out after dilation, just the little cheapy ones. Those actually block one of the most, the little plastic little
Yep.
foil things that go across.
Yep.
They actually block more of the UV light than all the high-end ones.
Sure.
But yeah, you're right. There was like some of the gas station ones actually block more UV
Yeah.
light out than some of the fancier designer frame
Mm-hmm.
ones.
It's amazing that we are willing to pay so much for a brand name when maybe the effectiveness is not as good as our little roll-up sunglasses after your eye exam.
Got to look good, right?
You got to look great, I guess. I guess that's what it is.
That's why they stamp Maui Jim right across the temple
Yes.
there too.
Yeah.
Like, would you wear a $5 pair of glasses?
If they were cute, yeah. I have some like $15 ones. I don't need the name brand. Just
As long as they're
Just
cute, but you don't care about the UV blocking, right?
no, I do want them to UV block. But we're saying even if they're cheap, they can still block the UV, right?
Absolutely.
So as long as they're cute and they
100%.
block the UV, then
Wouldn't-
yeah,
2 for 1, yeah.
there we go.
You're mentioning about like Maui Jims on how they block or they enhance the colors and everything too. I was
Yeah.
even thinking now that the Tigers made the playoffs and everything, like they play all these day games. They've been playing at like 2:30 and
Sure.
and when we're in Houston, but now they're playing 4:30. But I wonder what glasses that the outfielders are using. If they hit a pop fly and that white ball, because I did a study in college for softball, but they use the optical yellow ball, and I did fit them with blue contact lenses to make that pop. I'm like, I wonder what sunglasses that they're doing to make that little white ball pop against that pale blue sky.
Yeah.
Maui Jims.
It could be Maui Jims. I'm like, there
might
has to
be
be
Maui
something.
Jim.
They should be wearing
Yeah.
something to make that
For,
enhance
like,
a little bit further.
contrast.
Absolutely.
Don't they have something like golf glasses?
They do, yeah. But kind of give that same that same concept, seeing that little pale white ball in a pale blue sky.
Yeah.
The contrast is horrible. Then you put a cloud in there, and then it's done.
Sure.
Like you, I hit the ball like 450 yards, so yeah, you just lose it all the time.
Oh, yeah.
Typically it's on the green, but
I, to be honest with you, probably can't even hit the ball.
No,
I'll
my-
just swing for days.
no, I just I hit it and I listen for mine. It either hits a tree or it makes a splash. So
But you've got excellent vision, so
excellent
you
vision.
don't
I can
need-
see the splash very
Yes,
well.
Yes, you can.
Yeah,
Absolutely.
one of these days I'll get better at it. Maybe I do need to get the glasses so I can see the ball better.
Maybe.
We're about out of time, so thank you for joining
Yeah.
us this afternoon and spend a couple hours with us.
Thanks for having me.
And hopefully we'll get you back again.
I think-
Amanda as well.
so.
Get you both back in here and go over some other fun topics,
Yeah, it's been fun. Thanks for having me.
as always.
See ya.
See ya.